Okay, first off, my name is Darrell O'Sullivan, and I am on the board of directors of the Western Neuropathy Association, and it is my pleasure to host today's webinar. Just as a preference, this webinar is intended to inform members and caregivers on products and devices marketed to treat the symptoms of peripheral neuropathy. The Western Neuropathy Association does not endorse or receive any financial support from vendors or presenter of the webinar. There is no cure for peripheral neuropathy, and effective medication and therapy varies widely among neuropathy sufferers. It is my pleasure to introduce to you Dr. Phillips. David B. Phillips is an MD, PhD, an internationally recognized electronic medical device inventor who holds many patents and received the Inventor of the Year Award in 1986 for inventing the infrared ear thermometer that is the standard for taking the body's temperature all over the world. Today he's going to talk about ReBuilder, which he invented for peripheral neuropathy because his father was suffering for neuropathy and could not tolerate the medications. Dr. Phillips is the chairman of the board certification committee of the American College of Physical Therapy. Currently, he instructs other physicians seeking board certification in neuropathy, chronic intractable pain, and for opiate addiction withdrawal. It is my pleasure to introduce Dr. Phillips. So Dr. Phillips, it's all yours.
Well, thank you. Appreciate the invitation. As I said, I've spoken to your group before, I think in 2001. The ReBuilder has been around 30 some odd years. That's kind of saying something by itself, but I'm really not here to promote the ReBuilder. I'm going to explain how it works and why some people might want to try it. But yeah, my basic background is that I spent 10 years as a psychotherapist and dealing with people who had emotional problems. I kind of got burned out because they kept coming back with the same problems. They'd say, "Hey, doctor, my head hurts every time I do that." And I said, "Well, why don't you stop doing that?" And they come back and say, "Doc, my head hurts." So I got into hypnosis, and I just hypnotize them and be done with it. And that's how I got into hypnosis. And once I got into hypnosis, then it helped me to focus on my inner voice, so to speak, and accessing information that I had seen and learned and heard over the years to solve problems. After that, my kids got together and they said, "Dad, you used to make more money when you were inventing medical devices. Why don't you do that?" And since they were all getting ready for college, I said, "Okay, I think I'll do that." So I wound up getting my MD degree primarily for credibility and publishing and things like that. And that's what I've been doing. My first device many, many years ago, 40 some odd years ago, my wife, 28, developed lumps in her breast, and we couldn't decide what it was, and the doctors at that time couldn't decide what it was. We had a janitorial service. I had no medical training whatsoever. And I said, "Well, this isn't going to work. We got to figure out something." So the final thing, they said, "Well, wait 2 or 3 months. If it goes away, it's probably fibrocystic. If it doesn't go away, it'll probably kill you." Now, we had 4 little children. And finally, one of the doctors said, "I recommend a bilateral prophylactic mastectomy. If you don't have breasts, then you never have to worry about getting breast cancer." Well, I've always been a bit of a smart aleck, and I said, I don't really think that's good. I think if he told me he had some kids and he wasn't going to have any more, and I said, "Perhaps if we removed your genitals, you would never have to worry about that kind of cancer." And he threw me out of the office. So I had to discover and research something on my own, which I did. And I finally had it proven at the Memorial Sloan Kettering Cancer Center at 94% accurate when their X-ray mammography was only 84. And the system I designed provided the test in about 15 minutes, non-invasive, didn't hurt anything, and it gave the female the results before she left the office. So I got into it with that. Then during the years after that, my children or family developed something, and so I had to to figure out a way around that. There's a childhood skin disease called molluscum contagiosum. My 4-year-old granddaughter got it. It presents with hundreds of lesions all over the body. So I developed a cure for that using silver. And then another of my grandchildren was dehydrated, went in the hospital, and they tried to get a line going. And of course they couldn't, being dehydrated, and a young child, he was about 4 or 5. My wife was there and she came home and says, "You got to do something about this." So I invented a electronic device that you touch to the skin, numbs the skin, and it makes the blood vessels pop up as big as a soda straw. So you get venipuncture very easily. I sold that to Cancer Treatment Centers of America, and they're still working on it. So I've developed a number of different things. Well, as I said, what we're going to talk about today is my father had coronary artery bypass surgery, and he was an old Irishman and from Chicago. That's where I was raised. And they take the greater saphenous vein out of the leg to use for grafting material. Well, naturally have less blood flow. And because anytime you cut the skin and go in there, you're going to cut nerves. So they told him, Earl, you need to walk a couple of miles a day. And he said, "Oh, cut me from this to foot to my butt. I can't walk. I can't do anything." So they gave him pills. That made him really sick and miserable, and I couldn't hardly talk. So I had to develop the ReBuilder. So then I had to learn everything all over again. And what I was taught in medical school is always, and that all doctors, it's 10 years old by the time we get it. By the time something gets researched, something gets discovered, something gets developed, something gets published, gets into an application into a book, the book companies review it, then they have to print it, then they publish it and put it out, and then various medical schools have to decide if this is what they want to use. So you got 10 years. So the things I learned about neuropathy, and most of the things that your doctors are going to tell you, unless they're younger or really aggressive and keep up on their learning, it's not true. It's just not true. And they will give you tests where they'll stick a needle in your foot and a needle in your hip, give you a real good shock and see how long it takes that signal, that shock, to travel up your leg, and use that as a means of determining if you have nerve problems. Well, that's not how it works. The nerves actually carry a waveform, a shape of the wave. And if you look at Frank Sinatra and put him on an oscilloscope and you have him sing My Way, there's a certain sequence, a certain waveform there that will show up, and you can identify if this is him singing or somebody else. Now, I can sing My Way. I did it my way, but somehow or other, can't make the money that he made because my waveform doesn't match his waveform. So when you stub your toe, that's a particular waveform. When you stick a needle in your toe, that's a waveform. If you have pressure, that's a waveform. If you walk across the carpet and you get thousands of little lumps in the carpet touching the bottom of your feet, that's a different waveform. So that waveform is what gets transferred from the little tiny dendrites, the little tiny inner nerves at the end of the skin, through the nerve all the way up to the brain, so that the brain can say, it's just carpet, forget it. Or it says, whoa, I stepped on a nail, I better move my leg muscle to get that nail out of my foot. So that's what I first discovered. Since I had been working with oscilloscopes and things like that, I developed an oscilloscope attachment that amplified it by about 1,000, and therefore I could look at the waveform. Now at the time they had TENS devices, and the waveform on a TENS device is square. It's like a light switch. It goes up, it goes over, it goes off. That's it. And it goes up and over and off at about 100 cycles a second. Well, when I looked at the speed of which the nerve moved up from the foot to the brain, it travels at about 7.83 cycles a second. So if you overload it, like screaming at a child, it can't hear what you're saying. You got to, and if you whisper, sometimes people hear better. And if you're singing a wonderful song in the right frequency, they hear it even better. So these TENS devices tend to just overload and block the nerves. And when you block the nerve like that, if you do it long enough, the nerve just shuts down and you wind up with numbness. And numbness is one of the symptoms of neuropathy. So I looked at that waveform and I said, well, I've got to fix that waveform somehow. So then I had to figure out how to measure that waveform easily in a home care device. It's very expensive to go to the hospital, expensive and tiring to go to the doctor's office, and you're sitting there with people who are coughing and moaning and who knows what undiagnosed illness that they have. So I figured out how to do that. So what the ReBuilder wound up doing is it analyzes the actual waveform, the shape of that wave. I send a signal from one foot to the other. We use a split compartment foot bath with warm water and Epsom salts and electrolyte, and I'll explain why, but the warm water vasodilates or opens up the capillaries because sometimes we have poor blood supply. So I solved that problem while we're testing, sends a signal from one foot to the other. When it gets to the other foot, that foot says, hey, something just happened. I got to tell daddy. So it sends a signal to the brain to say, hey, I just got a little tingle here. And so we capture that and we look at it. We say, aha, that's not a very healthy signal. So we create a signal where the signal goes and it has a lump in it. We create a signal that has a depression. And because we know what a normal signal looks like. And so we send that signal and then we coax it 7.83 times a second. We send that signal for 30 minutes. And that kind of eases, just like when your child wakes up from a nightmare and you rub his head and you talk to him kindly, eventually they calm down. Same thing if the dog is barking because they see a cat, you calm them down. So it calms down the nerves. So what it does is it wakes up the nerves that are numb and not working, and it also calms down the pain oversensitive nerves, which is why the ReBuilder can solve pain and numbness. A TENS device only blocks the pain, and it only does that while it's on. So we're actually re-educating that. Now, what we were taught is that there's nerves that go from the toe to the brain right away. Well, that didn't make a whole lot of sense. When you do autopsies, there's half a dozen different nerves that go, and they don't touch each other. One, you get a dendrite, which is at the skin. It picks up the signal. It sends the signal. Doesn't care what the signal is, but it sends it to the cell. The cell is like a miniature brain. And that point, that says, is this important enough to send to the brain or not? If it decides it's important enough to send to the brain, then it sends it down what's called an axon. That axon is covered in a fatty sheath called the myelin sheath. And we'll talk about that with statins and why statins can cause neuropathy, because it etches away that myelin sheath and take away the insulation from that. But anyway, so it goes from that axon to the next nerve. And the next nerve has dendrites, and it's supposed to pick up the signal, but they don't touch. It goes through a sac of water. It's called the synaptic junction. Pure water, distilled water, does not conduct electricity. It's an electrical signal. So you have to have minerals in that synaptic junction. And it picks it up from the blood supply. And so it picks up that synaptic junction, picks up the minerals, makes it conductive. The nerve goes down, it jumps across to the other dendrite and goes to that nerve, and then that nerve jumps till it gets to the brain. And if the brain decides that it wants to move the foot or something, it sends the signal back down to enhance and change the motor. Nerves so that you move your foot off the nail or rub your foot or put a salve on your foot or do something. So that's how the nerves really work. And what we're taught is that there's nerve transmitters, dopamine, acetylcholine, adrenaline, and that these chemicals are what carry the messages. Well, chemicals do not carry messages. It's an electrical signal. These chemicals change the conductivity of that fluid, makes it less conductive or more conductive. You take a cup of coffee, it makes it more conductive, which is why you're more jittery. If you take a Valium, it depletes some of those minerals and signals get across much slower, so you get more relaxed. Now, the 7.83 frequency, we found out, also causes the body to relax. It causes the brain to release endorphins. Endorphins travel throughout your entire body to relax and make the entire body less painful. Runners experience what's called a runner's high. If they run long enough, their knees get sore, they're continuing to run. Normally, you run away from a lion, you run 200 or 300 yards, and your body's capable of doing that. But runners will run 2 or 3 miles, so the brain says, wait a second, this fool isn't going to stop. My knees are beginning to hurt, so it releases endorphins to solve the knee pain, and it makes the patient feel euphoric. They feel like they can run forever. So that's what endorphins do. So the ReBuilder, by sending that 7.83 frequency, causes the brain to release endorphins, travel throughout the blood. So if you have a little bit of arthritic pain in your spine or your hips or your shoulders, it kind of calms that down temporarily, not permanently, but calms it down temporarily. The other thing is that in the warm water, we put electrolyte and in it, which is a mixture of minerals. The blood, because it's warm water, it absorbs it in the blood supply right there at the foot where it's needed most. So the synaptic junctions, if it's depleted of minerals, picks it up from the water. So that helps. Also, the signal stimulates the nerve, corrects the nerve, but it also has what's called EMS, muscle stimulation component built in. So it causes the calf muscles to contract and relax, just like you were walking. So a 30-minute session is equivalent to a 30-minute walk without wearing out your knees or your hips. And many people have poor blood supply as part of the comorbidity associated with neuropathy. So the ReBuilder kind of strengthens the muscles in the legs. So other than that, the ReBuilder doesn't do very much. So I'm open to questions.
Okay, so thank you. That was excellent. So participants, I hope you can hear me. So please ask questions about the ReBuilder or other things related to your peripheral neuropathy that you think that would be really worthwhile asking Dr. Phillips. We're waiting now, so open for questions and answers. Lindsay, are you there?
Can you hear me?
Yeah,
Lindsay?
so I'll unmute those. There's a couple people that raised their hands, so I'll.
Oh, I did
unmute
just to
them.
find out what was going on, so that's all right.
Yeah,
But yeah.
yeah. Okay, Marty, go ahead. You had a question?
Marty?
Marty, are you there? Nope, maybe not. Okay. All right, how about Helene? Did you have a question?
Whoops. I've been using the ReBuilder for maybe close to a year, but I don't use your foot bath. I just apply the, the things, the pads to the bottom of my feet or wherever. Am I missing out? Do I need to switch to using exclusively the foot bath?
The pads will work, but they only stimulate the nerves under the pad. So put them on the bottom of your foot, the circuitry is not going through your toes. And many times it's the furthest extremities where neuropathy starts, the toes. Okay. So you're not treating or diagnosing the toes. Also, you're not vasodilating the skin on your feet, which can help refeed the nerves with nourishment or blood supply. So the foot bath is the preferred way of using it. It's kind of a pain in the butt to have to take it to the sink and fill it up, 3 or 4 inches, and then drop your electrodes in there, and then you got to empty it and then dry out and wipe out the bucket. However, you can put a garbage bag in there and you don't have to clean the bucket if you want to. So that's the best way of using it. Although you're probably getting some results with what you're doing, but you could enhance it. Now, we also have a bunch of accessories. We've got foot pads. My wife and I have a motorhome. And of course, she's got neuropathy now. I'm 75, she's 73. It's something that happens as you get older. So she wanted to drive down the road in the motorhome with her feet in the buckets. So I therefore had to invent something. So I invented foot pads, and they're conductive, coated in silver, and you dampen those and it connected to the wires. It just slips in there and you put your feet on it, and the entire palmar surface of the feet are touching that. And it's not quite as good as a foot bath, but at least you're touching the toes and you're touching the heels and the ball of your feet and all of that. You can also take a washcloth. Some people have it only in their toes. So one of the things I suggest is that you can take a washcloth, fold it in half and fold it in half again, so it's about 4 by 4. You take one of the rubber electrodes, you dampen it with electrolyte and Epsom salts, and sometimes you can get by with just the Epsom salts, frankly. The electrolyte adds about 5%, but if you don't have it, just buy some cheap Epsom salts. It works just as well. So you put the electrode within there and you roll it up on like a sausage, and then you put your toes over that. So like this. So then the signal goes through the toes and all the way up the body and treats the entire foot. You can do the same thing with your hands. You can take a washcloth and dampen it, put the electrode in there, wet. That makes the entire washcloth, by the way, the electrode. Put just your fingertips on there, and that way the signal goes all the way through your fingers, your wrist, all the way up and around. So there's a couple of ideas. So it's probably working for you, but it could work a little better if you use the foot bath. But my wife goes back and forth depending how busy she is and how much time she has.
Did those other pads come with the unit?
No, those are accessories. You can go online, rebuildermedical.com, and you can buy that. Anybody who's listening to this now, I would suggest going online and then getting the phone number and calling Brian, and he's arranged for a discount for anybody who wants anything, the ReBuilder or any products. He's got a significant discount, but you got to ask Brian. Actually, he gave me the code to put in, but I don't remember what it was. I can't remember what I had for breakfast last week.
We'll ask him to give us a call or send it to us.
Okay.
I said, we'll ask him to send it to us. So I have a couple more people who have some more questions. Here's one question from one of the participants. Some people do not get relief with this. Why would that be?
Comorbidity. Unfortunately, people, Vietnam veterans, they were subjected to Agent Orange. They were in the woods, and in order to clear out the vegetation so that they could find the enemy, the planes would fly over, drop Agent Orange. It's a defoliant. It's also highly poisonous, especially to the nerves. So a lot of these fellows had poison in their system, and they still do. It really annoys me that a government doesn't take care of our veterans, but that's a whole nother time for a whole nother story. Yeah. But if you have comorbidities, sometimes you got to clean that up. Farmers have been exposed to chemical weed killers by DuPont, and that can poison you. Some people, many older people over 60 or 50 even, that our doctors have prescribed statins to kind of clean out some of the fatty tissue within the blood vessels in order to make blood flow smoother so you don't have a heart attack or a stroke. However, once it does its job and etches away the cholesterol from the inside of your veins, then it looks for someplace else to take the fat from. And like I said, the myelin sheath, which is part of the axon, a major part of the nerves, is covered in a fatty sheath. It starts to etch that away. If you take away the insulation from the wires on your switch, your light switch in the wall, pretty soon if they touch, you're going to create a fire. You're going to get a short circuit. So some people have taken too much statins or taking it too long. We've recently learned that some antibiotics have a side effect of peripheral neuropathy. Another thing that can be causing it that the ReBuilder just won't bother, can't touch, is and it's about a quarter to a third of the patients need to look at this. They have an impingement in their lower back. Just work too hard, and the vertebrae are stacked on top of each other like dominoes, and the nerve goes between these pieces. And as it twists, it squeezes that nerve, and that can cause the problem. So you really need to go to a chiropractor and see if you can get that corrected. If it's not corrected, then the signal travels up from the toes to the ankle, to the knee, to the hip, to the spine, and it's supposed to jump across the synaptic junctions of the spine to get down to the other foot. It's hip and knee and ankle and toes, but it can't do that if it's pinched off, like pinching off a hose. So you want to check on it. Now, there are some devices you can get for about $250 on Amazon. It's called a Healthy Swinger, I think. You lay on your back, you put your ankles on it, and it swings your feet back and forth. And pretty soon your entire body goes back and forth. And it can loosen up if you don't have a pathological impingement or subluxation in your spine. It can clean that up. I think ReBuilder even bought some, and I think we sell them at cost. But you can get them on Amazon. And I recommend that works pretty good. Also, these inversion tables. If you don't go totally upside down, go maybe halfway down, it stretches your back. And as it stretches your back, it stretches the vertebrae, opens a space. Many times we're dehydrated. So those spongy tissue between the vertebrae have shrunk. And so if you stretch them out, then the blood supply nearby can fill it back up and they become spongy, and the discs separate more, making a larger space for the nerve to go through. So if you can borrow one or find one of those inversion tables, inversion chairs, again, we don't sell them, that can help. Massage can help. But primarily, if you're not getting a lot of results from the ReBuilder, those are the reasons. That's one of the reasons the ReBuilder has a 90-day money-back guarantee. If it doesn't work for you, send it back. It also was the only device I know of that has a lifetime warranty, which means if it breaks anytime in your life, send it back. We've had people put it on the roof of their car when they're getting in the car and forget it and drive off and they run over it. And we get a Ziploc bag full of pieces. And we just send them out on a new one. It's easier, and they're usually happy.
Can chemotherapy be a comorbidity?
Oh gosh, yes. That can be, that's a major thing, comorbidity. Diabetes is a comorbidity. Untreated in particular. And so diabetes many times results in amputations. Chemotherapy does that. Now, if you go online and watch enough YouTube and study enough, then you can kind of clean out your system. Vitamin C is very, very good for that. It kind of flushes your kidneys. Vitamin C is water soluble. We're one of the few animals that can't make vitamin C. Dogs can create their own, but you have to then take it 3 or 4 times a day. So if you say, I'm going to take 1,000 milligrams, better to get 250 and take it 4 times a day. I've got little gummies. I keep them in the office. I keep them at home. And sugar's probably not all that good for me, but I get my vitamin C and I get my vitamin D.
Here's another question. It says, my neuropathy is only triggered by pressure, like standing on them or pressing the gas pedal in the car. would the ReBuilder be appropriate?
Well, it's worth a shot. It depends. If you have an impingement, you can have an impingement in your nerves anywhere. If you've had a broken ankle, we get a lot of athletes that have get swollen ankles, and they can hardly walk, and they can loosen that up. The vasodilation opens up the blood vessels, the muscles contracting. You can actually see your calf muscles contracting when you're using the ReBuilder. By the way, any physical activity and muscle activity has a metabolic byproduct, and it's called lactic acid. It's what makes your legs sore when you do too much exercise. And the way the body moves and gets rid of that lactic acid and takes it to the kidneys and liver to be put into the bloodstream and the urine to get out, that is called the lymphatic system. Lymphatic system does not have a heart to pump, so it uses the muscle pump, so it's called the venous muscle pump. When you squeeze that valve, the leg muscle, either by walking or electronically, like the ReBuilder, as it squeezes, it pushes like a banana out of its peel, it pushes it uphill. When it relaxes, when the muscle relaxes, gravity starts to pull it down, and you have a valve there. When the valves don't work right, you get what you call varicose veins, but it holds it. And so every time it squeezes, it pumps that lactic acid out. So if you don't have strong enough calf muscles, you're not doing enough walking or exercising, then that lactic acid is staying there, and you're not getting a lot of blood supply. Peripheral artery disease, peripheral vascular disease, where you have a heart problem and it's just not pumping enough blood all the way down to the extremities, that can be a comorbidity. So those are some of the things that you might want your doctor to check on. Check your blood pressure, check it yourself at home. We have what's called a white coat syndrome. Your blood pressure always goes up in a doctor's office. Check it at home. They've got devices now that you can just hold in your wrist and stick your finger in there and push a button, and it'll give you your blood pressure. You don't need the cuff and all that. So a lot of these things are cheap and can be used now yourself to monitor yourself. You can buy a blood glucose monitor at the drugstore, little strips, and check your blood glucose a couple times a day. Make sure that your sugar levels aren't too high, and take care of that. Personally, my blood sugar kind of goes up and down, so I use monk fruit instead of regular sugar. I've tried all the saccharins and all that kind of stuff, but aspartame, stuff will kill you. But monk fruit looks like sugar, tastes like sugar, cooks like sugar. So I kind of go overboard with that. But if you do think that you have a sugar problem, that's one of the small things you can do. That answer helps.
Another question is, you mentioned the myelin sheath. Could someone with hereditary type neuropathy, axonal type, benefit from the ReBuilder?
Yes, if the disease, if what you're inheriting is a lack of myelin sheath, then probably not. But that's very, very unusual, because if you can walk and talk and ask a question and think, and if you can see, hear, taste, and smell, then your nerves are probably working and your myelin sheath is not a problem. Now, I think that probably you could inherit a situation where you're very, very sensitive to things in the environment that could etch away that, like statins. But I really haven't come across that. I don't think I've ever come across that situation. But again, it's like the, pardon the expression, but the Jewish people in New York say, wooden Hoyt. You can try the ReBuilder. If it doesn't work, send it back.
Yeah. So the next one is, can you use a ReBuilder if you've had knee replacements?
Oh, yes. It's very helpful for knee replacements, because anytime we have to cut surgically into your skin, we're going to cut nerves. You can't help it.
Mhm.
So those nerves, when it's healing, the nerves develop like blood supply collateral circulation. So if you cut a nerve in your knee, the surrounding nerves take over the load, and it goes around that knee and up to the brain. Now, if you don't reestablish that, then sometimes it's always off a little bit. So many people with a knee replacement complain that their balance isn't exactly the way it was before. Now, electricity takes the shortest route. So when you have 1 foot in one foot bath and 1 foot in the other foot bath, the only way for it, that signal to get from the right foot to the left foot is to travel up the leg past the knee. And at that point, it takes the shortest route as long as the knee has healed. Now, we also have some attachments, some conductive straps. Many people have been told they need a knee replacement when, in fact, they can, to use these straps, put one strap below the knee, one strap above the knee connected to the ReBuilder, and I designed that in a certain way so that it focuses its energy right on the joint itself and can stimulate the hyaluronic acid. And sometimes you don't need a knee replacement. But if you've had one, that can help. And if you do have a knee replacement and you're not walking very much, you can get what's called disuse muscle atrophy in your calves. And the best way for that is walking. But if you can't walk because you're still healing, then the ReBuilder stimulates those nerves electronically. You can actually see it and feel it.
Okay. So another question is, does Medicare cover the ReBuilder?
It's covered by Medicare, but not very well. $69. And they expect you to go to the doctor and get a prescription to rent the ReBuilder for 90 days. At which point you have to go back to the doctor, and the doctor says, well, I think that you've done well, so now I read a prescription to purchase it. So it's a lot of trouble for very little money. They used to cover it all the way, but Medicare, as the government begins to run out of money, they've been cutting back on most everything. I mean, they're cutting back on insulin right now. I mean, give me a break. So it is a covered expense. Sometimes your private insurance will cover it, but unfortunately, I can't tell you that the whole thing or 80% of it will be covered.
Okay. Next is, can the myelin sheath be repaired with peripheral neuropathy supplements?
It can be repaired all by itself if it's not being continually damaged by statins or other poisons. Even some allergies can affect that. Yes, some supplements can help that. Magnesium, NAC, NAD, vitamin C, of course, vitamin D in particular with this COVID nonsense. Yes, the myelin sheath is very progressive, and it's perfect for a long time, like till you're 60. And then prickly toes and burning feet, and then it progresses. If that's happening, it's probably the myelin sheath. If you're 30 or 35, it's probably not the myelin sheath. It's probably an impingement or some kind of poison.
Okay. So next one is, sorry I came in late from a doctor's appointment anyway. Do we have your website, contact information, and price for the ReBuilder? I think we'll have that available through our website as well. Yeah,
you can have that. There's two devices, 300 and a 2407. The 300 has two pads that come out. You drop one in each foot bath, or you hold one in each hand. It treats your hands or your feet. 2407 is two of those in one box, so you can treat your hands and your feet simultaneously. It's a 30-minute. So if you ride the little one and you have problems with your hands and your feet, then you got 30 minutes for your feet, 30 minutes for your hands. But so if you want to speed it up, you can get both of them. The 2407 also has just an EMS setting. So if all you're looking to do is strengthen your muscles after a knee surgery or something, that can help. One is 800 or 900 and the other's 1200, I think, something like that.
And the next one is, what causes zingers that shoot through your foot and into your toes?
Well, it's a problem with the dendrites not getting enough nourishment or not being healthy and sending signals to the nerve cell itself, or the nerve cell itself is just become overstimulated and it passes every message up the brain. People say they feel like they're walking on pins and needles. Some people say they can't feel the difference between a carpet and the normal floor. So the problem is usually a symptom of peripheral neuropathy. Now it's a progressive disease. Your toes are further away from your brain than your fingers, which is why it starts in your toes and then can move to your fingers. Now there's neuropathy can also travel to your internal organs, and that can cause organ failure. So if it's not treated effectively, it can go and be spread throughout your body.
Next question is, can CSC units block pain signals from the feet?
CNC.
No, SCS. Excuse me if I must have said it wrong. SCS. I have no idea what it even is.
I'm not real sure. Many devices use initials to describe themselves. It just depends if maybe that person could.
Yeah, if you could add a little more information, we might be helpful. So
It's probably a TENS device.
It says self-contained stimulator.
Yeah, that's like I have a car.
Not enough info.
I have a motorcycle.
Okay.
I really don't know. If it's a TENS device, it can block the pain while it's on for a while in a very local area. But it shoots way too much energy. It shoots a waveform that the nerves are not, that's not what they normally use. And it sends it at a frequency of 100 cycles at least, rather than 7.83. So it just overloads the nerves totally and they just shut down, which sometimes that's okay. If you get your toes caught in the lawnmower, then put a TENS on your ankle and your hip and get your butt to the doctor. But it's not a permanent situation. The ReBuilder actually rebuilds the nervous system.
Okay. I think at this point, that's all that I have as questions. Do you want to have sort of a summary and then we'll go from there? Anybody else have any questions? Please let me know right away.
Some of the other things that I'm working on might be of interest. We've had a couple of friends get tick bites. And we have a dog, we have horses, and they have ticks. And when you pull them off, you leave the proboscis, the drilling teeth kind of things in the skin. And the way a tick works is that it injects a fluid and it thins the blood and it can suck the blood, and that's how it lives. And then it lets go after a while. So if you pick it off or pull it off, sometimes you leave those little things in there. Same thing with a snake bite or a wasp bite. So I have had to, I'm in the process of working on a device that reverse syringe. A syringe, when you push the button, it pushes something out. This one creates like pulling the syringe out. And you put it over the skin, and when you hit the button, it creates a vacuum, and it lifts the skin and the tick up. and it reaches a certain level, and there's an electrode there, a little tiny electrode. It's only 9 volts, but it annoys the tick and annoys him pretty much to where he says, I got to get out of here. So he pulls out his teeth, his proboscis, and leaves a hole. The vacuum then pulls out the saliva that he's used to thin your blood, and it's removed, and then you can dump it out. So we're doing that just because I don't like ticks.
Okay, so a couple more came up, a couple more questions popped up while we we're talking.
Sure.
So it says, I have it, one implanted, and I have one of these CSCs, they said, it's implanted in his back.
Okay.
So I don't know what kind of device that is.
It's a TENS device that's implanted and sends a constant signal. Some are constant, some you can adjust. And those are for really, really traumatic cases, probably where there's an impingement or a trauma in the back.
Mhm.
And that can be very helpful. It's much better than drugs. And the ReBuilder, like I said, if you have an impingement in your spine, the ReBuilder is not going to do anything. And if you have too much statins, you're still taking them for 10 years, it can't really do it because it's taking 1 step forward and you're taking 2 steps back. If you've had Agent Orange, that darn stuff stays in these poor guys' systems like PTSD for the rest of their lives. So if the nerve still has some patency, and if there is some blood supply getting to it, and if there's some muscle tissue still left to push out the veins, the blood in the veins back up to the heart, and to push the lymphatic fluid up, then the ReBuilder can be helpful. If not, it's not going to help.
Okay. Next question is, are you doing anything on tinnitus?
Not yet. I wish I could. Actually, I have a little bit of it. Of course, now that you say it, I hear it.
Of course.
I didn't hear it till you said it. I kind of drowned it out, you know?
Yeah, I know. So the next, well, the one
No.
more question. Oh, I'm sorry. One more question that is, says, do you know of the Beamer, BEMER system, which sends a certain wave to stimulate the blood in the capillaries and small vessels?
Yeah, that's an electromagnetic electronic device that creates a pulse. And I have heard some interesting things about that, particularly if your problem is due to inflammation. So it's a very expensive, I think, but yeah, you could try that. Now, there are various devices that use very high frequencies or a variety of frequencies, and they can work because they accidentally hit the right frequency and stimulate the nerves, or they block the signal. The Beamer, I think, may have some merit. I really haven't researched that enough to know, but if you can borrow one and try it, that's always the best way.
Okay.
Sure.
Excellent. So I think that we've covered all the questions, and I think you've given us an excellent presentation. And I really appreciate all of the information that you've shared with us and all the detail and your willingness to answer all the different questions. So someone just popped up on the chat here. Let me just quickly look at that and see if that says here. It says, so they just said they have to go. And so they said, thank you. So anyway,
Okay.
on behalf of the Western Neuropathy Association, I want to say thank you very much for spending your time talking to us about the ReBuilder, and for that matter, answering all the questions that everybody had. I think it was very well done, and appreciate it very much.
Well, I enjoy it. If you got another 5 hours, I could keep talking.
I think we understand that one too.
In the
Okay.
meantime, if you're interested in some of the other products and stuff, call Brian, 304-725-2202, and he'll fix you up. He's the
Okay.
president.
Okay.
I'm retired now. I'm kind of playing on my boat and motorcycle.
There you go. Anyway, thank you again very much. We appreciate
All
it.
right, thank you. Have a good day.
You
Bye.
too. Take care. Okay, everyone. Thank you for attending, and we'll talk to you again in about a month. Bye-bye.